This is a very, very special edition of Conversations with Ed. Those of you in the Richmond area who've been watching my show, Conversations with Ed, for the last year, know that I always open up talking about McGuire VA Hospital. I'm a wounded warrior myself, having served with the 101st Airborne and the 7th Special Forces. I'm a patient at this hospital, as I have been at several other VA hospitals in the systems. Without a doubt, this is the very best hospital in the system, and it's time for you folks and you guys out there to know what's available to you and what you can be taking advantage of. We're going to give you a tour. We're going to take you around the whole hospital to show you the different sections, the different clinics, the operating rooms. We're just going to give you a whole concept of how wonderful this circumstance is. And just take a look, if you can, at that sign, and you'll see why this place is so important. As it is right now, the wounded warriors that come back from overseas, they come to Bethesda Hospital, and then they send them directly here, because this has the best traumatic care system in the VA system. With all of that being said, we have to introduce you to the people that make all of this work. And right on the top of the list is Miss Edwards over here. Miss Edwards is the head of public relations. She's responsible for allowing us, our film crew, to come through and show you what a wonderful facility it is. And I do want to get a few words from her because she knows everything that's going on here.
Thank you so much. We're glad you're here. Thank you for coming.
Our pleasure, definitely.
It's really awesome to have the community come and see a little bit about what we do every day.
Well, tell me what it is that is the most important to you.
I think the most important thing every day is through these doors behind you, American heroes walk through those doors, and we have the privilege to take care of them. Men, women, active duty, veterans, we have the privilege to take care of amazing people and offer them wonderful health care services to help them even when they're sick, feeling bad, or even to help keep them healthy.
Isn't that outstanding? There's a lot of things that go on in the VA system, and most of them you can take advantage of right here at McGuire VA, and that's what we're going to show you today. And Miss Edwards, thank you so much. All right, nice finally meeting you too.
Oh, it's wonderful having you.
All right, maybe we'll see you later on.
Absolutely, I'm going to be with you.
Oh, great. Okay, all right. So get ready now. You know, when you watch my shows, you have to have a pen and pencil. What we're going to do, we're going to act like I'm a new vet signing in, and we're going to take you right through the process. Central registration, and then from central registration, we're going to go and visit some of the most outstanding clinics in the United States. Stay tuned. As we said, we're going to show you the whole process and how it works. I'm sitting here with John Knowles. I never knew your last name, John. I've been knowing you.
Dowles. Yes, D-O-W-L.
Don Dowles. I know John. I've been a friend of John's for probably 10 years now, yeah, coming in and out. But if you come in as a vet, a new vet, coming in to get what you are supposed to get, this is where it starts. Now, theoretically, I would have handed John already a copy of my DD-214
and a picture ID or any valid ID you have.
Okay.
All right.
And any other paperwork we need besides that?
That's it. If you have health insurance, so you bring us your health insurance card, and that's pretty much it. As far as paperwork. Now, the information that we'll ask you, if you know it off the top of your head, fine, or you can just have it written down. And that would be your income, your spouse's income, if it applies, and if you're married, like I said, her social, date of birth, and you all's wedding anniversary date. And if you all have children that are college age or younger, and the ones that are in college or younger, name, social, dates of birth of each child, and the ones that are in college, the name of the university and the phone number and address of where they are. If you have a child that doesn't live with you, the address of where they are, social, date of birth, and if you pay child support, the amount of child support.
All right, now what is all of that information for?
That is just part of the registration process because it's income-based. Anyone that's enrolling after January 2003, which would be you, is based on your income. If you did not see combat or you're not service connected. and we'll just assume that everyone is non-service connected, meaning they're not getting VA disability, or they, in your case, did not serve in Vietnam or the latest Iran, Iraq, Afghanistan conflict. If you did not serve during those campaigns and your income is over a certain limit, you wouldn't be eligible.
Now, if you are a combat vet, I'm a combat
Yes,
vet.
sir.
Okay. Does the whole picture change?
That overrides the income requirements. We still take your income, but the income doesn't reject you. If your income is over a certain limit, it won't reject you because of the combat.
All right. Now, sitting behind this
Yes,
desk for
sir.
so long, what is the most common problem? And so we can tell our folks how to avoid it when they come in.
Misinformation.
Misinformation.
Yes, you have to have your DD-214.
Okay.
And now if you don't have it, we can look up some information, but it makes life easier for both parties if you do have it.
Okay.
And even if you don't ever set foot in the VA, you should have your DD-214 with you for your own personal records.
Now, what's the next step? Where do you go from here?
After we get you registered, we assign you to a primary care team if you want to be seen here. And that will be done electronically. We send an email to our coworker that sets the appointments. She'll set the appointments, and you'll get a postcard in the mail at a later date letting you know the time and date of your appointment and the clinic that you've been assigned to.
All right. Do you have any advice yourself, having, again, been here doing this so long, to any of the young men or ladies who should be coming in here to see it? Because a lot of them are not. That's why we want to let them know about it.
You don't have to wait until you retire or until you lose your health insurance at your current job to come in. Once you've finished your time in the military, if you've been discharged honorably, come in and get registered, whether you want to be seen here, or not. Because once your name is in the system, that's it. And if you want to be seen here for whatever reason, all we have to do is update you. Let's say you get registered and you don't come back for 2 years. And in year 3 you come back, well, we just update your name and demographics.
You're already in the system.
You're already in the system, and we can go from there.
And the system means that you get medical care,
Yes.
prescriptions,
Yes.
just about
Yes.
anything
Whatever
relating to
whatever
health.
we offer here, you're entitled to.
Outstanding.
Yes.
Thank you.
Glad
John.
to do it.
Pleasure.
Glad to do
Pleasure.
it.
Thanks a lot. Okie doke. All right, look at this place. Now, we're in the VA hospital. We're on the roof. Isn't this a great area to just come and sit down and just chill out? Look who I'm with. You met this man on the show, Fernandez Scott. We call him Dez. He's also in public relations here at the hospital. In fact, Dez is partly responsible for getting us the permission to come out and do what we're doing. And what I'm going to do now is I'm going to ask him to tell us what we're going to do for the rest of the day, because you set up a nice program for him. Good to see you,
Good
too,
to see
man.
you too, Ed.
Okay.
Welcome to the VA. We have a full day planned today. We've already hit central registration to get an understanding of what it takes for a veteran to get enrolled into the VA system. Next, we're going to have our social worker, one of our coordinators for the homeless program, to come and talk to you about our initiative, the VA initiative to end homelessness amongst veterans. We have a very aggressive program. So one of the questions I want you to ask her is about the HUD-VASH program. HUD-VASH program.
HUD-VASH program,
yes.
okay.
As well as our homeless stand down, which is coming up November the 15th.
And what is that going to be? What is the homeless stand?
The homeless stand down program, I don't want to take all her thunder, but
Okay.
basically we invite all veterans within the community to come in for a day of care. That's getting a haircut, shower, getting fed, getting coats, boots, underwear that have been donated by the community to the VA for veterans that need certain things right now to get back on their feet.
People don't realize that the homeless rate among veterans, all the way back, Vietnam veterans, I mean, it's just amazing. And they don't need to be homeless.
Right.
And that's what we're trying to get across. If you folks that are looking know somebody, because they're probably not looking at this, but you are. So if you know somebody, or you have a friend that knows somebody, let them know that there is help right here. You don't have to stand on the corner with a sign saying help, give money. You have help here. You earned it. It's yours. Come and get it. Now we're going to tell you how to do that through the day as we go on. I think we're getting ready to talk to this young lady.
Yep.
What's her name?
Her name is Endora Terawali.
I know Endora. Yes, I do.
So she'll be up next. Then we'll proceed on to 2C, to basically the pain clinic.
Yeah.
Well, Dr. Lester
Yeah.
will be there to demonstrate some things that they do.
Uh-huh.
We'll talk to Dr. Pai, who's the medical director for our polytrauma unit here at the VA.
Very interesting point. McGuire Hospital is rated #1, I believe,
Yes.
for traumatic care. So when the fellas come back, the wounded warriors come back, they hit Bethesda first, I believe.
Yes.
And from Bethesda, they come right here for their continuing care, for whatever it is that they need to make them whole again. And it's a wonderful program. I'm glad you said that.
Yes, it
and we're
really
going to
is.
get to talk to
We'll get to talk to the medical director. Dr. Pai.
Outstanding, outstanding. So,
And then after that, we'll go downstairs to the pool where there's the therapeutic recreation. One of the things veterans don't know is that we have those type of rehab programs here. So we'll talk with a representative from physical therapy
Outstanding.
to talk about some of the new programs that they have going on.
you set us up then, didn't you?
Yes, sir. I tried to give you a wide scope of things that we're doing here at the medical center.
Outstanding. That's what we want people to know. So we're going to bring this young lady up. Give us a second, and I think she's going to have some very interesting things to talk about. You're going to be with us for the rest of the day.
Absolutely,
right?
sure will.
Outstanding. Good
All
deal.
right, we'll see you.
Okay,
Thank you.
Stop.
All right.
All right, we're continuing on with our visit and our conversations with Ed at the McGuire VA Hospital. Now, as we said earlier, there are so many different departments in here. We probably won't get to all of them, but I'm trying to make sure we get to the most important ones. And this young lady, Endora.
Yes.
Endora has a very important position dealing with a situation that most of us are not even aware of, and that's homeless vets. How can a military veteran in the United States be homeless? Well, they are, and she's going to tell you what McGuire VA Hospital is doing about that problem in Richmond.
Good morning. Thanks for having me on the show.
You know it's a pleasure to have you
It is
on.
all my pleasure. My name is Endora Terawali. I'm the Healthcare for Homeless Veterans Program Coordinator. The program is a concerted effort by Secretary Shinseki to end homelessness, veteran homelessness, by 2015. We provide comprehensive services in the community at the medical center and also in local institutions such as jails, hospitals. Our plan is to connect with any veteran who is homelessness or at risk of homelessness to ensure that they have a home that they can call their own and to minimize any further risk of homelessness.
Now that sounds like a big project. How are you going about reaching out to the community?
Okay, that's a great question. We provide outreach to shelters. We also provide outreach to housing programs. We build relationships throughout Richmond with landlords, with hospitals, with community providers, including Richmond Behavioral Health Authority. We also provide in-reach within the medical center. Oftentimes, even doctors may not know exactly where we are in the services that we provide. So it's important for us to build relationships throughout the hospital and throughout the city.
Now, is there a criteria or are there certain requirements that this homeless vet has to fit into in order for him to qualify for help like this?
The biggest criteria is probably eligibility based on the discharge status.
Yeah.
So unfortunately, if a person does not have a discharge status that is either honorable or under honorable conditions, but we will still connect them. No one is turned away. So even if they have a dishonorable discharge, we still consider them as having served in our military and will connect them to resources.
Outstanding. Now, I understand you have a big project coming up in November.
Yes.
November the 5th, is it?
Yes, November 15th, actually.
November 15th.
Yes, it's
What
the
is-
homeless stand down. And anybody who's familiar with military terms understand that a stand down means stop everything and
right.
focus energy on this task. And our focus task that day will be the stand down, which is a outreach event. Last year we served over 500 veterans who were either homeless or at risk of homelessness.
Wow. Now, how does that community get to know that November 15th is the day?
Okay, well, this is a great venue. We've also sent out email messages to all of our community partners. We've posted throughout the medical center. Our public affairs office is advertising the event. The word gets out. We are in shelters every week. We do outreach to 2 or 3 shelters a week. So we're definitely disseminating the information. Please, if you know of anybody or have a venue where you can share that, absolutely.
Well, I can share it. My show starts up again pretty soon, in fact, this week. And I will put it on there. In fact, you might want to come on and talk about it too.
Oh, I would welcome that opportunity.
Well,
Thank
then
you.
we'll work that out.
Okay.
We'll work that out. That's a good thing. So this is just another example of how this particular hospital, and I'm sure that there are other VA hospitals across the nation that are doing basically the same things, but without a doubt, this hospital has been rated in the top 10. And that top 10 includes civilian hospitals also.
Okay.
Yeah. And also, just as a point of interest, this is the second largest office building in Virginia. The largest one being the Pentagon. And here we are at McGuire VA. Isn't this beautiful? I mean, if you have to have treatment, if you are ailing, if you have Agent Orange, if you have anything that requires medical assistance, wouldn't it be nice to be able to have it done at a place as nice as this? Now, young lady, I know how hard you work, okay, because I'm in and out of here quite a bit. You probably didn't even know that I did this.
You're a man of many talents.
Many talents. Well, I try, but this is a work of the heart.
Yes.
Because the VA has saved my life. Okay, I've been in the system, military system, for over 50 years. I know I don't look that old.
No, you don't. You don't.
But everything that we're saying here, and the reason we're showing you, is because there are so many of our brothers and sisters out there, military-wise, who are not taking advantage of this opportunity. You have earned this. This is for you. All right?
I want to get my contact information.
Please, give it out.
All right. We are located on the 2nd floor of the medical center near the Intervention Pain Clinic in 2 Charlie 166. Our phone number is 804-675-5000, extension 2041. And if for some reason a person doesn't have access to a phone, we do have a 1-800 number where we can be reached through the National Call Center for Homeless Veterans. And that's 1-888-434-3838. That's 1-888-4AID-VET. Thank you.
Very good. And I'm going to give you a date. Yeah, okay, and make sure it works for you to get on the show.
Absolutely.
And I'll be talking about it up until that time, and then
Okay.
you'll make it a big deal. Might even have you and Des on together again. All right? Thank you so much.
Thank you.
All
Thank
right.
you so much for the opportunity, Mr.
With
Coleman.
all of that being said, we're going to take a short break. I understand that we're going to be able to go down to the pool area and actually see some of the rehabilitation techniques that are being done. So you guys stick around, keep that pad and pencil ready, get on that phone while we're having the break, and tell everybody, tune in. This is great. Ed Coleman is presenting the McGuire VA Hospital live and in living color. Thank you. Ed.
Thank you.
Thank you so much. Okay, welcome back once again to Conversations with Ed, this very special edition. As you know, we're at McGuire VA Hospital here in Richmond, and I'm going to keep saying it all through this particular show. It's rated in the top 10 hospitals in the United States, and right now we're going to give you the reason why. I'm sitting now with Dr. Pye, a young man, but in a very, very, very precious position. He heads the polytrauma unit here, which this hospital is known for. The patients come from overseas, from the battlefield. They come into Bethesda Hospital, and then they're shipped right down here for the best polytrauma care in the United States. Am I exaggerating?
Well, you're definitely making me blush here, but you know, it's our goal to do that. These are service members, young men and women, that deserve this kind of care.
Let's do something before you start telling us everything.
Sure.
As I asked the question earlier, what does polytrauma mean?
Yeah, so polytrauma is really, when there's a single event, single injury, and you have multiple organ systems that are damaged. So it could be the brain, it could be the spinal cord, it could be your eyes, your vision, but then you have multiple fractures, you could injure your lungs, your heart, any or all of the above. But the reason why it's so complex is these blasts that folks are getting exposed to abroad can injure multiple organ systems.
IEDs.
The IEDs, correct, correct. We just have to make sure that we're looking at everything, not just the brain if there's a brain injury, but we need to make sure we heal those fractures. We heal the psychological wounds, along with maybe the major injury that's physical or organic.
Outstanding. Now, how do the patients themselves, how do they, because I know there's a mental aspect.
Yeah.
I mean, I went through it. So
Sure.
there's a mental part. It seems like, just from me being in and out of here so much and seeing the guys, it seems like the atmosphere here is welcoming. And
Oh, yeah.
am I wrong on that?
You know, that's one of our major goals, to make sure that folks understand, feel part of their care. You know, typically if somebody goes to the physician, or at least in the past, it used to be that they go to the doctor, they tell the doctor what the problem is, and the doctor tells them what the answer should be. Well, we don't work like that over here, and medicine is changing these days. So our goal is to understand what the injury was, what the problems were, bring the patient and their family into the care, and have them tell us what their specific goals are, and then modify our goals based on what their goals are. Their goal may just be to get out of the hospital. And so we do a lot of training with the patient and the family to just teach them how to take care. Yeah, exactly.
Okay.
Exactly. Others maybe to walk off the unit. And so there's a different focus and a different goal for each person.
And you recognize that.
Oh, of
that
course,
everybody's,
of course.
That's outstanding. Now, I had another question while you were talking, and again, it floated right through my head. I was going to ask you what new techniques, right?
Sure.
This is what I was going to ask you about, because you know, they came out with new things during Vietnam. Crazy glue. A lot of people don't realize that crazy glue was developed for battlefield wounds, so you could close the wound up real fast. Everybody thinks it's just to stick something on the wall.
Yeah.
Have they come up with new treatments and new things?
You know,
I know they have 50 years. They have to have something.
Yeah, definitely. One of my favorite. So actually, a big part of these injuries, because it can include a lot of burns, fractures, things like that. There's a lot of pain involved.
Yeah.
And pain care has made tremendous leaps and bounds.
I know.
Right,
Yeah.
right. Moving somebody from the battlefield to 12 hours away in Germany to another 6 to 8 hours away in Walter Reed to the Richmond VA, you know, that continuum takes a lot of ample communication with the teams. So every Thursday morning, the docs from Kandahar, Launchstool, Walter Reed, and then all of our polytrauma centers, we get on a call on Thursday mornings, and we discuss the folks that are coming through. So we have an eye in the sky, kind of.
Wow.
We know what's going to be hitting our doors.
Wow.
Also, the advances in what are called peripheral nerve catheters, where in the field, a medic can place a catheter, or anesthesiologist in the forward operating base can place a catheter for pain control, so the person can't feel their arm because the pain's coming from that arm. And that's transported all the way through the continuum. But my favorite is actually acupuncture. So,
Yes.
So you're probably familiar with that.
Yes, I am. Wonderful.
Battlefield acupuncture. I was trained earlier this year in it up at Walter Reed, and takes 10 needles throughout 5 on each ear, and it can tremendously decrease pain in the moment and for at least the next few days. It can actually reduce the amount of pain medication a person is taking because they're no longer feeling the pain as
I
bad.
can testify to that. Dr.
Yeah.
Sidhu
Yeah,
was doing mine, and I tell you, it was like a miracle.
Right.
The way that, just like a sheet was taken off.
Exactly.
And I feel great now.
Right.
And so it does work. Well, Doctor, I know that you're a busy man. Is there anything that you'd like to say to our viewing audience that they need to hear? And I want to thank you for letting us talk to you, number one.
Oh, it's my
but
pleasure.
for everything that you do here, because the word is out. You run a great clinic here.
Well, I appreciate that. I appreciate you coming by. And to the audience out there, I just want to say your support of our veterans and our service member is second to none. We really appreciate that. Your ability to take care of our own, the folks that have taken care of us, it's all the worthwhile. Okay.
Yeah, just in closing, Endora asked me when she gave out the number for the homeless vets, the toll-free number is 1-877-424-3838. And on that note, we're going to close up for a little bit, get relocated to another area, and show you some more of what's going on at McGuire VA Hospital. Stay tuned. Thank you, Doctor.
You're welcome.
Welcome back again to Conversations with Ed. We're here at McGuire Hospital. The tour is going great. Right now we're looking at something, I think this is relatively new, this technique, is it?
Actually, it's about 30 years old.
About 30 years old. Never heard of it, but I just saw it, so now I'm a believer.
Yep.
All right. Tell us exactly what you're doing. Tell me your name again.
Okay, so I'm Ruth Meyer. I'm a kinesiotherapist at McGuire Veterans Hospital. And the technique I did today is called Watsu, and it's been around for about 30 years or more. And it was founded by Harold Dull out of California. And it's a combination of shiatsu massage and water. So it's done in the water. And it's all American.
Well, we were watching as you were doing it, and your name again?
I'm Will Huppert.
Will Huppert. Nice to meet you again.
Good to meet
Will,
you.
Right. He looked so comfortable. I mean, he just looked like he was just in paradise. Yeah,
weightlessness.
And did it help you?
So far, yeah.
And this is your first treatment?
This is the first treatment on the Watsu, yeah.
I think that you're going to have him here quite a bit
I hope
because he
so.
looked very comfortable out there.
It was a trial. We were going to see how much he enjoyed it.
All right. What other treatments do you do? More besides the water treatment?
So for chronic pain management, we try to educate veterans about a lot of different techniques. So breathing techniques, mindfulness techniques, stretching and exercise techniques, and then if it's musculoskeletal pain, we do hands-on techniques that involve trigger point and myofascial release and craniosacral work. There's a variety of different techniques out there, strain, counter strain, a lot of different named techniques, but we manually help to assist in stretching and then instruct the veteran on techniques on what they can do at home.
Other than the water treatment, do you do other kinds of therapy in your field here?
Yes. So as a kinesiotherapist, I specialize in therapeutic exercise. So with Mr. Huppert, what I've been able to do is instruct him in exercises that are helpful that he can practice at home and give him the tools. So he does stretching, he does walking, he does deep breathing, he does some yoga stretches. We use some tools, a foam roller, cervical traction, a little back knobber thing that gets to points that he can't get himself. He does some self-release techniques. So we try to empower the individual to help themselves through their episodes of pain or dysfunction. And
Well,
so
I'm going to
problem
suggest
solve.
Tai Chi. I'm going to suggest if you have a Tai Chi studio in your area, I would suggest
I
that you
think
try
that'll
that.
be coming up eventually.
I think
Yep,
you should
so
do
we
it.
do offer Tai Chi here, and
You
there's
do?
also I Chi that we offer is in the water. So yes, so we do
So
actually
I'm on the
offer.
right page. There
Yep,
you go.
exactly.
Okay.
So
okay.
anything that involves a combination of the mind, body, spirit, you're combining together all of those things to really help with the healing.
Now, do you help the chronically injured, like the amputees, and
I help anyone who
isn't that great?
comes into me.
Isn't
Yep.
that
Pain is
great?
pain.
Yep.
Yeah, pain
What-
is pain. You're
Yeah,
absolutely
pain
right.
is pain, and the pain can be from a variety of different sources. So it doesn't. There's no limitation on the diagnosis.
Well, this has been very interesting. Thank you for
Well,
letting
thank
us
you.
talk
Thank
to
you.
you and,
Yeah.
and watch you relaxing out there. And you're doing a wonderful job.
Thank you so much.
Thank you so much.
Thank
This
you.
is Ruth Nightingale,
Yeah, that's you said that in the water. You said she was like the angel.
angel of mercy.
Isn't it great? Isn't it great? Well, I appreciate it. We're going to take
Thank
a
you.
break now and
Okay.
just kind of slow down just for a few seconds. Stay tuned. Keep your pencils and paper ready because we are going to have other things. You got to grab the phone. Go right ahead.
Okay, thank
We're
you.
done. Thanks a lot.
Bye-bye.
all right? All right, welcome back to Conversations with Ed, and we're still here. We're at McGuire VA Hospital, and right now we're in one of the most important sections and segments, good catch, huh, of the hospital. This hospital is the first VA hospital to do a heart transplant in the United States, and I think they're now the only VA
The only
hospital.
VA hospital that does
Does
it
it.
in-house.
In-house, right? So they're known for that. We did the polytrauma, so you see why I'm so excited about letting people know all of the services that are available. You can get rebuilt just about here. Now, this young lady that I'm standing next to, tell us your name.
Lisa Martin.
Lisa is the young lady just joked that said she's the woman that you call at 4 o'clock in the morning when you have a chest pain. And they do that too, don't they?
Yes, they do. Yes.
She's
All
going to
the time.
explain a little bit. She can't explain everything because obviously there's a lot that goes on here. But a little bit about what she's doing and about these gadgets we're just holding in our hand. Go for it. Tell us
So
about
this
it.
is a left ventricular assist device, what we call an LVAD. This particular one is made by Thoratec. It's called a HeartMate 2. We were actually the first hospital here in the city to start implanting these back in September of 2008. So we've been doing them about 5 years. And this actually sits in the heart, attaches to the heart. Blood actually goes in through here and then goes up through the aorta. So it actually just bypasses the left side of the heart. All of this is under the skin. So it sits in the patient like this. And then the electric wires come out the skin. They plug into a computer, which is this. And then the computer plugs in to 2 batteries that the patient has. So they're actually electrically powered a heart pump. So what happens is these patients have end-stage heart failure and they come to us and they're just so sick and they're not able to do anything. And once they put this device in, it gives them their life back. I mean, we have patients, well, the best thing that we can hear is that they say they feel normal again.
Wow.
But we have patients, we had one particular patient, he hadn't walked in about 5 or 6 months and he's actually riding a bike now, which is pretty amazing. We've got several of these patients that are almost 5 years out. We've done about 60 or 70 of these devices. We're still the only VA in the country that implants these in-house. We've gotten calls from everywhere to see if we can put these in patients. We just got a call from Alaska about 2 months ago.
Wow. So would you bring that patient down
We'll bring
here?
that patient here. And so currently we're following patients from Florida to Boston to Houston. We actually had a patient in South Dakota that we followed.
Wow.
And he's since been transplanted, but that was a challenge to follow him from South Dakota.
Now, how long can they keep this device in?
Well, it is, most of the patients are what's called a bridge to transplant, so they're waiting for transplant, but there's so many people waiting for transplants that, the list gets longer and longer. So really it's driven by the patient. If they take care of the device, don't damage any of the wires, it could go, the company has people that are almost 8 years out.
Wow. So you're giving them their life back.
Exactly,
That's
exactly. And the one particular patient that we have that's almost 5 years out, they have family all up and down the East Coast. And so whenever we call them, we never quite know where they're going to be. If we need to get them in for a checkup, we call them several months ago, and I think they can fit us in next month, which is fine. I mean, the best thing that they can tell us is that they're normal again.
Okay. All right.
It's pretty amazing.
Well, see, here's another story for you, and you see why, again, why I wanted you to know and see instead of just listening to me talking about it on the show. I wanted to do something special so that you could really see what I've been talking about all of this time and why you need to be here. You need to be here. If you are a veteran of the United States military, they promised you when you signed that paper that they were going to take care of you for the rest of your life. Right here's where it starts. Thanks again. We're going to take another break. We might even just call it a day, but we'll see. Thank you so
Thank
much.
you very much.
And so pleasant. So pleasant. I mean, the patients be happy to come in and see that smile.
Well, I hope so. I
All
hope
right.
so. It's a great job I have. So.
That's that, and everybody that we've talked to has said the same
Yeah.
thing, and it's very evident in the care that you get. I just had surgery here last Wednesday,
Great. Well, you look wonderful.
right? So it's a good thing. Okay,
It is true that a lot of people don't know that, we do such wonderful things here in the city. I mean, I didn't know that before I worked here. I've been here 10 years and I had no idea. So anybody that we can help, we're thrilled.
you heard it. Okay, stay tuned. Hey, welcome back to Conversations with Ed. We're still at the hospital, McGuire VA Hospital, but before I left, I had to make sure that I introduced you in person to the ladies that I always talk about when I start my show. This is Peggy, live. She's a real woman. Okay? And Dorothy, they do exist, and they are two of the nicest women that you're going to meet anywhere. I just wanted you to see them since I talk about them so much.
Thank you.
All right? Now, y'all make sure you watch the show. Okay?
Right.
All right. All right. Take care now, right? Thanks a lot, too. Thank you so much. Okay, baby. Yeah, good deal. Okay. You my hug, too. Okay? Good. Good. See, that's why I wanted to do the show, so I can get my hugs. That was good. Okay, we're getting ready to finish up. What we're going to do is we're going to go outside and show you the van that the hospital uses, and then we're going to close out. I think we've done a pretty good program for you. I think you got a good idea of some of the wonderful things that are happening right here in Richmond at McGuire VA Hospital. So stick with us for a couple more minutes, and then we'll be done. Hi, Ed Coleman. Welcome back again to Conversations with Ed, this very special edition that we're doing direct from McGuire VA Hospital here in Richmond. As I told you earlier in the show, we're going to take you all over the hospital to show you some of the wonderful things that they do. Right now, look where we are. Mobile van. And Sharon Roan, who's the director of that program, is going to tell us all about it.
Yes, Ed. We have a Rural Health Initiative program here at McGuire, and we've been around for 3 years. And our goal is to seek out veterans out in the rural and local communities who really don't know that they're entitled to VA health care. Once we locate them, we advertise, and we work with our veteran service organizations, church groups, health centers, Bon Secours, and other partners to disseminate information. How can we help find our veterans out in the rural areas? We will set up a location. We will invite our veterans to bring a copy of the DD-214, and then we determine their eligibility for health care. If they are eligible, then we can set them up for appointment for a future time on one of our mobile locations or our community-based outpatient clinics, which we have one in Charlottesville, Fredericksburg, and Emporia. Or we could make an appointment here at McGuire.
How's the response been?
It's been wonderful, wonderful. This year we have seen over 1,000 patients on our mobile unit. Here the Native American unit as well have seen a tremendous amount of patients out in the rural areas as well.
Now the Native American unit, you go down to the reservations, down to the Indian...
Yes, we actually go to their tribal centers and see our Native American veterans and do primary care. So we're there on a routine basis. That Native American unit, which also conducts primary care, they have 11 to 14 various locations they go to monthly.
Outstanding, and the response, I'm sure, has been...
Yes, it is. Now, mobile schedules are listed on our website on www.richmondva.gov.
Now, do you have anything coming up that we can let the folks know about?
Well, actually, we're partnering with the City of Richmond. We're hosting a Veterans and Family Resource Fair on November 7th from 10 to 2 at the Caroline.
At the Caroline?
Yes, sir.
Okay,
Yes,
see
sir.
that? You heard it here. You'll hear it again. I'll get a chance to promote it this week on Conversations with Ed, the regular programming that's going to be coming on. The Veterans Organization, the McGuire VA Hospital, they are here to help you. When you sign those papers, whether it's 1 year ago or 50 years ago, the United States military said they would take care of you for the rest of your life. And you need to be taking advantage of it. Things like this, you get to meet these people. As you've seen, everybody that we've talked to has been very much into their job, their position. They're all smiling, they all love what they're doing, unlike some other military establishments you might go to. I won't mention any names, but New York. But it's a great place to be, especially if you're not feeling well. We're gonna just about end now. I want to thank Sharon. I want to thank all of the other staff at the hospital for being so open and just letting us just go and showing us all of these wonderful things. And just as an add-on, we just found out that a majority of the hospital is powered by sun. It's solar powered, so they're also energy conscious and conservation conscious also. Sharon, a pleasure meeting you.
It's been a pleasure.
I'm sure we're going to talk again
Thank you,
because I like this. I like this concept. We might be able to set up some locations for you also.
Wonderful,
All
wonderful.
right.
Please contact me.
Will do.
Thank you.
All right. Thanks a lot.
All
Right.
right.
Welcome back once again, Conversations with Ed at McGuire VA Hospital. This is a special edition I want to thank the hospital, Mr. Dez, we call him, his name is Fernandez Scott. He's the public relations officer here, and he's part of how we got to be able to come in and get all of the cooperation that we did get. We felt like we did a good show. I hope that you enjoyed watching it as much as we did doing it. Dez, I want to thank you.
Thank you.
All right, and you guys really came out for us, and we really appreciate it. And I hope you folks learned something. All of you fellas out there, ladies too, who are military, veterans, out of the service, whether you've been in combat or not, if you were in the military, you need to come over here and get registered. It's no pain. You just come and you fill out the paperwork, and the next thing you know, you'll be able to take advantage of some of these great opportunities that are offered to us, those who served. Thank you for watching. Hope you tune in to my show.